Dr. Klasko, good morning.
Good morning. It's just absolutely great to be on stage. It was captivating to listen to the beginning of this. I'm excited to be here.
Thank you. It's great to have you with us. Can I ask, because it looks like it is sunrise in your lovely backdrop, where are you calling us from today?
Calling from the 31st floor of 1101 Market Street in birthplace of our nation, Philadelphia, Pennsylvania, actually about 5 blocks from Constitution Hall. And, just for this discussion, we were sort of the cornerstone of the pandemic. We had 18,000 people in our hospitals. We had among the lowest employee infectivity rate. We've been a champion of some of the racial injustice issues, and we, like everybody else, faced the financial tsunami that hospitals and health systems had to face. So we are a good example of an epicenter of what's happened over the last 15 months.
No, that's great. Thank you. I was actually just going to say what inspired you to talk about this topic in particular, but I guess you summarized it quite nicely there. You are the epicenter of both social and health issues for the last 18 months, so it's going to be interesting to see what you've experienced and maybe how you see the future of the health sector. So I want to start with something a little bit more general, Dr. Klasko. I would like to hear from you, why do you think this is the best time to be a healthcare professional in the United States?
Well, it's the absolute best time to be a health professional in the United States if you're willing to be part of a revolution.
Mm-hmm.
If you want things to be like they used to be, it might be the worst time for you. And I'll give you an example. When I went to Wharton, I was one of only 3 physicians that was getting an MBA at Wharton, and I would go on weekends, and everybody say, "Wow, you are so lucky to be a doctor. A few $1 trillion industry in that's going to go through this huge transformation." And then I'd be in the OR lounge on Monday, and I'd have this, same inputs, but the doctors would be going, "Boy, I'm telling my children not to go into medicine." So here's the issue. It's no different than where retail has been or hotels or whatever when there's a disruption. When Amazon came in, Target and Walmart were optimistic because they said, "Hey, we're really good at what we do, but we are now going to join this revolution." Sears and Penny's, not so much. So at Jefferson, while we've scaled from 2 hospitals to what now will be 18 hospitals, our entire vision has been healthcare at any address. So we embraced the digital revolution back in 2014, where we spent $35 million in telehealth. But we didn't talk about telehealth. We said, how can we get Jefferson out to the 97% of people in Philadelphia that are not patients, that are people that want to be able to thrive without healthcare getting in the way? So to me, that is the secret of the digital revolution, but with the caveat that it's going to be painful for those who don't want to think differently as these new ecosystems are built.
Okay, great. I mean, you mentioned the word revolution there, and you also mentioned how you were probably even ahead of the curve in 2014, rolling out your digital transformation. So I wonder, if you were doing that sort of 7 years ago, why are we still talking about this digital transformation, and who do you hold most responsible for the state of the current system and maybe almost its reluctance to change and reform?
Well, look, I'm a fellow of the World Economic Forum and the CEO of one of the large global finance firms. We were having coffee, and he said, it's interesting to me that 35 years ago, the 2 sectors that had escaped the consumer revolution were banking and healthcare. And then he took a sip of his coffee and said, "Now you're alone." So if you just think about that for a second, literally 35 years ago, we would have been talking during the pandemic of people lining up to deposit their checks. And it wasn't it wasn't mobile depositing or ATMs. It was a recognition that we need to democratize finance, right? So we don't get up in the morning and say, "I think I'm going to tell a bank." It's just that we get angry if we have to do anything in a bank. So look, I think that who's to blame? I'll talk about the United States because I know it best, but our health policy has been congratulating ourselves for giving a lot more people access to a fundamentally broken, fragmented, expensive, and inequitable healthcare system, and then hoping that the healthcare system would transform. All you have to do is look at the pandemic. American hospitals lost hundreds of millions of dollars. American insurers literally had their best year ever. In what other industry would you have the middleman prosper, while the people that are providing the service go away? By the way, the insurers didn't do anything wrong. we just live in a model in the United States, at least, where that kind of thing is okay. Supply chain costs have gone up significantly. So if you just think about the Affordable Care Act in the United States, you would have thought you should sell all your insurance stocks and your supply chain stocks and pharma stocks, because in every other revolution or every other time where you've given more people access, the middle folks have had to detract. But frankly, insurance stocks in the United States and pharma stocks were probably your best stock to buy. So I think they're to blame. We're to blame as providers, because we lived on. One of my colleagues said, you guys have lived on drugs because you could always just charge more and the insurers would pay for it. Why in the United States do we pay our dermatologists and orthopedists 15 times what we pay our primary care docs? And then when our primary care docs to quarterback the system. So we've run amok, frankly, in a system that has no chance of being sustainable. And it's time to really make the kind of changes that we're trying to make at Jefferson.
Okay, I'd like to put a pin in that, please, Dr. Klasko, because obviously you've given us a little bit of context about maybe what healthcare has been like for the most recent past. But now we've acknowledged something needs to change and the customer needs to be put at the heart of the healthcare sector. So you mentioned technology earlier on. What role do you think technology has to play in changing healthcare to this more customer-centric model?
Yeah, well, I think that's a great question, because I think technology is necessary but not sufficient. And I think this first wave of digital transformation has done a lot of things. We were a foundational partner of a company called Livongo, which really treated diabetic patients not as patients, but as people that wanted to be able to thrive without diabetes getting in the way. And that turned into an $18.5 billion company. I think that what we have to be careful of is that these technologies don't just make the wealthy healthier. So what we're working on at Jefferson is partnership with companies throughout the ecosphere that are looking at how do we get care out to where people are, no matter what their situation is. So we're talking with one company that's doing drone delivery of food and drugs to try to get rid of food deserts. But here's the issue. The root cause of a lot of this stuff, none of this works unless you have connectivity throughout, right? So I had written an article where connectivity is the new vital sign. When you look at Philadelphia, the number one reason people got in the hospital or died was not masking, was not social distancing, was not their genetic code, it was their zip code. There's zip codes in Philadelphia where 70% of people didn't have broadband. So all the things that we're talking about at this great conference that helped people survive the pandemic, whether it was telehealth or online education, were not available to those zip codes. So I think the what gets me excited is that we are starting to be able to, at Jefferson, have some significant partnerships with digital technology companies that are not vendor-vendee. We are partners. We are co-developing. It's diversifying our portfolio so that if I have to move patients out of my hospital, which is where my traditional revenue is, I'm actually participating in these companies' success that are, in essence, making it more difficult for my traditional math. We call it the old math and the new math. The old math being inpatient revenue, outpatient revenue, in-person tuition, and NIH funding. The new math being innovation, strategic partnerships, and real partnerships in digital technology.
Okay, thank you. So you've obviously highlighted there how important technology is. Let's have a quick look at the Triad: people, process, and technology. Do you think any of them are more important when we talk about the future of healthcare, or do they all need to be equally bear in mind in order to achieve that end goal that you're mentioning?
Yeah, so I think that's also a great question. I think they're all important. I think we've probably concentrated a little bit more on the process and technology, and really probably haven't spent enough time of what do the humans look like in this model that really now has robots and others doing a lot of the work that we did. So we still accept medical students. We have the third largest university medical college in the United States. Most medical colleges still accept medical students based on science, GPA, multiple choice tests, and organic chemistry grades. But we're amazed doctors aren't more empathetic, communicative, and creative, right? I mean, as my kids would say, duh, right? So, and why was that? It used to be I had to be able to memorize the Krebs cycle as a way to get into medical school, because if I knew 19 reasons somebody had a headache and you only knew 15, I was a better doctor than you. But now the 19 are on my supersized iPhone or Android. And pretty soon, I'm an obstetrician. Pretty soon there will be a robot next to me that will take a picture of the baby I deliver and be much better than any human at being able to memorize what that would look like.
Interesting. Obviously, this session is about marriage between healthcare and technology. Do you think there's also a marriage there between healthcare and education then?
Well, I just think that we have to be cognizant of the fact, Kai-Fu Lee in his great book AI Superpowers, talks about OMO, online meeting offline. What about the human in the middle? And that same World Economic Forum meeting, Jack Ma said, when we created cars, we didn't try to get humans to run faster. When we created planes, we didn't try to get humans to fly. He said, computers will always be smarter than doctors, but they'll never be as wise. So how do we start to think about what the role of a human is in these great advances we're going to have, where AI, drones, 3D printing, genomics, and robotics all come together and do a lot of the things that I used to do. So just to give you an example, one of our most successful projects this year was a wearable. And the future I see is that you'll go to sleep at night with a wearable that will monitor just about everything you do. And you'll wake up in the morning, and if there's anything you need to do, a robotic text or whatever will come back to you. So that changes the role of doctors. My car gets better care than I do today, because while I'm asleep, it's sending signals out to the manufacturer. When I wake up in the morning, when I turn on the car, it says, Steve, before you get your coffee, my left passenger tire is flat. Could you fill it up? I'm going to get a physical 3 weeks from now, and somebody's going to tell me my blood pressure is X, my EKG is Y, and my calcium score is Z. Here's what I should do for the next 18 months. Again, in today's world, that is 1980s.
Yeah, for sure. Okay, well, on that note then, why do you think everybody is so scared of disruption and change, particularly within healthcare? And also, obviously, you mentioned banking is another institution that tends to kind of not conform to transformation as much as everyone else. Why is this?
Look, I think we're scared. I mean, it's a complex question, but I think part of it is there's a great quote from Upton Sinclair. It's hard to get somebody to do something when their salary depends upon them not doing it. So, again, in the United States, at least, specialists have lived on a much higher revenue plane. Insurers have lived on this medical loss ratio model. How much can I get in at the beginning of the year? How little do I have to pay out? Certainly, hospitals have lived on this model of the sicker my community is, and the more they're coming to my hospital, the better I'll do. So I think some of this is we have to change the payment model. Secondly, I think we have to look at leadership differently. I think the fact is that I run an $8 billion academic medical center. Most of the people that got to where I am got there through a hospital administration or academic mindset. And that's not necessarily the mindset to lead a health system for the future. And then thirdly, I think from the Silicon Valley and the digital transformation side, we have to get away from this vendor-vendee model and really start to create partnerships. I'm frankly done going to HIMSS and having 870 24-year-olds tell me how they're going to transform healthcare with their app. There's got to be real partnerships. I wrote a book with Hemant Taneja, who is the managing principal of General Catalyst, and started out, what if a Silicon Valley entrepreneur and a CEO of an academic medical center walked into a bar, got married, had a kid? What would that kid look like? And in Philadelphia, we created that kid. We brought 60 people from General Catalyst together with our entire digital innovation and consumer experience team, and formed a company called Tendo. And the head of Tendo actually sits on my cabinet. So digital transformation is literally now part of our DNA.
Amazing. Sounds like a really great initiative and a very interesting experiment as well. What do you think the North Star should be for the next, say, 3 to 5 years?
Well, look, I think that I think we have to take a different approach to healthcare. I think we have to recognize that and it's not just in the United States. quoting Dr. Martin Luther King, that of all the forms of social injustice, healthcare inequities are the most shocking and inhumane. We've done almost nothing around that over 55 years. And the pandemic proved that. You know, if you're underserved, if you're a person of color in a place like Philadelphia or LA or San Francisco or Chicago, you had a much higher risk of being affected by COVID. We spend 80 or 85% of our money on the things that have, frankly, the least amount of effect on a community's health. So I think we have to look at health as the most important commodity for society. I think we have to relook at how technology can start to do something about food deserts, housing, education in a very different way. We have to stop incenting large health systems to just build new hospitals for sick people and start incenting places like ours to take that healthcare at any address to a different model. I think on the digital transformation side, we got to get away from the move fast and break things and creating just an app and start to look at how those apps can come together so that we're having responsible innovation and putting ethics in at the beginning. We've brought in an ethicist at the very beginning of our digital revolution to make sure that we're not sitting here 10 years from now looking like we are now with things like Facebook and Twitter and other things of saying, hey, how did we know that Facebook wasn't just going to be so I could see my unbelievably cute grandkids remotely, but actually affect elections and spew hate? And I think we need to look at that as we look at the fourth industrial revolution in healthcare, making sure that we're looking at privacy issues. There's going to be a lot of issues around sharing data. How do I make sure that if I'm sharing my genomic data, that that's staying private, that's not being sold to companies, the cybersecurity issues. So as we go through this revolution, we can look at what hasn't worked in other sectors of the economy as it relates to the digital revolution and really make sure that we are getting out to each individual and giving them a better chance of living a healthy life.
That's really interesting. And as you've said, it really has highlighted the inequalities within society. And I think you've mentioned some really great examples there of things that need to change. But I wonder now, as we sit in front of an audience of healthcare leaders and thought leaders, are you confident that we can get there?
I am. I am because I just, I spend a lot of time, I've become a little bit of a shapeshifter. I spend a week, a month out in, California talking to and being on the boards of several different startup digital companies. And then obviously I'm running this very large traditional healthcare ecosystem in university. We merged our health science university with a design university to create the first design curriculum in a medical school. I'm confident because I think two or three things will happen. I think, first of all, I really believe consumers will have their "I'm mad as hell and I'm not going to take it anymore" moment. My daughter, I'm an obstetrician. My daughter got pregnant during the pandemic. And, she basically said to me, hey, I had to go to the hospital 3 times a week to get testing, go to a place where there's a lot of sick people, have somebody put a monitor on me so I could stare at the ceiling and have a nurse tell me I'm okay. She got out of that and she said, I thought you were the digital dude, Dad. Why can't we solve this? Well, there are companies. I'm on the board of one of the companies that's actually looking at how do we create remote monitoring at home. What does that have to do with health equity? Well, my daughter could afford to go and take off from work 3 times a week, but there are folks that can't and just don't get the tests. And a lot of those babies end up in the intensive care nursery. So I think consumers will have their mad as hell moment. I think we'll start to see some new leadership across the spectrum. I know that a lot of the big VCs, certainly in California and Boston, are understanding this importance of partnership and not just creating apps. They're understanding the importance of bringing ethics in and making sure we're not just making the wealthy healthier. So I'm optimistic about that. And frankly, I think that the people that take over positions like mine will start to be younger, will start to be more folks of color, will start to be more women, and will actually be folks that come from different sectors, not just people that grew up in the old math, that will recognize that we have to take a very Apple in the 90s approach of looking at what's going to be obvious 10 years from now and do it today, and not just make computers and operating systems, but start to think about a digital lifestyle. That was a game changer in that industry, and I think we'll start to see more and more traditional healthcare folks partnering with traditional VCs and digital players, just like we're doing with General Catalyst and others.
Sounds like a really exciting and hopeful future as well. And in your daughter's words there, Dr. Klasko, I'll make sure next time we have you with us, I'll introduce you as the digital dude. I quite like that, Monica. That's quite nice. So on that note then, can technology itself bridge this digital divide?
Yeah, look, I think as I start to look at, AI is a great example of, being able to, let's take the wearable example. I believe that we'll have a wearable that will be able to capture a lot of that data. And that theoretically, let's take atrial fibrillation, that nobody should die from atrial fibrillation in their sleep. The issue becomes creating the technology so the 10 million sort of data points of people that are sleeping and getting all that data, that it can start to literally ferret out the one or two that need to be notified the next morning. That's where technology, I think, is going to be the real differentiator moving forward. We're getting close to that. We're getting close to knowing that a certain genome or a certain subtype will change the way that I might need to be treated. I had an interesting heart issue, and literally one of the changes for me was some dietary changes in my nutriomics, that some work had been done around my subtype of genes. So we're starting to see fragmented examples of where that's really changing care and changing lives. I think we'll start to see a sigmoid curve where some of that AI will be able to really make that kind of difference, where we'll start to look at humans more differently, where we'll start to look at things like drones for delivery, not just so that I can get my LP quicker, but that I can get food. Let me give you one example where policy and that comes together. We mentioned food deserts. Food deserts exist because in my zip code, I can walk to a Whole Foods and a Trader Joe's. In a zip code that has a 20-year less life expectancy, folks can only walk to a bodega that might sell chips and soda. So if we had enlightened healthcare policy where if people were willing to give their family healthy food, they get 20 or 30% more government-funded food, and we drone delivered it to them, that gets rid of food deserts. So I think we can start to look at that. I think the key will be titrating the incredible advances in technology with the ability to make them work for people and people throughout society. And I think we're gonna have some fits and starts in that over the next 2 to 3 years. But why I'm optimistic, I believe in 5 or 10 years, we'll be looking and saying, the pandemic of 2030 will be one where we'll have AI bots literally taking care of people that got anxious because they were thinking back to the pandemic of 2020. We'll have 3D printing masks in your home. We'll have wearables that will know that my temperature rose and that I shouldn't be going to work. So I think that's what we should be working toward. What would a pandemic of 2030 look like, where we have none of the things that happened in a fragmented basis here in 2020 and 2021?
Do you think, from your experience, that the physician workforce is ready for this digitally enabled, connected care system?
No, we're really not. And I think there's two pieces I'd say to that. First of all, as far as the education side, we need to really relook at our curricula. Traditional medical schools still have 16 weeks of biochemistry, 16 weeks of microbiology, et cetera. We need to put AI, we need to put health equities, we need to put healthcare financing, all the things that you talked about. We need to get that into the mainstream of medical education. Population health, social determinants, predictive analytics are going to be, frankly, more important for a future doctor and nurse than maybe microbiology, biochemistry, anatomy, unless you're going to be a physician scientist. And then I think we have to really look at our current workforce. At Jefferson, we started something called JOLT, Jefferson Onboarding and Leadership Transformation. And what we did is we recognized that about 20% of doctors get it, About 15% of doctors will never get it, and then there's a 65% in the middle. We found that as leaders, we spend about 40% of our time with the folks that get it because we feel comfortable, 45% of the folks with time with the people that never get it, and then the least amount of time with the people who change their culture. So at Jefferson, we did a model leadership academy where we have the people that get it be the teachers. We teach the teachers. People that never get it, we ignore. We call that administrative hospice. We just let them be comfortable and go off wherever they're going to go. We've done a 6-year program around the 65% in the middle, teaching them things like AI and, frankly, radical collaboration, radical communication, and some of these changes around predictive analytics and population health. And when we did our last study, we published 325% increase in loyalty, 300 or so percent increase in optimism about the future, because they feel better that they have the skill sets as faculty and practitioners for this very different future, and they're not scared of that transformation and change.
Great, thank you. Thank you so much. I like the idea of that 65%. We can convert them. We can definitely get them there. Thank you. It's been such a pleasure to open our summit with you. And what looks like a really beautiful day in Philly. So I hope you enjoy the rest of your morning and we get to talk to you soon. Thank you so much.
Thank you. I look forward to seeing you again. Thank you.